Hello, in these sessions we are going to learn the pleura. The pleura is a serous membrane which is covering the lungs. So here in this diagram you are seeing the trachea and we have the right and left lungs, and the serous membrane which is covering the lungs are known as the pleura. Okay, and it is lined by the epithelium of the pleura is, remember, it is mesothelium. Pleura, just like the peritoneum, the pleura is also formed by the mesothelium. It's a double layered serous membrane. It has got two layers. There is a parietal layer and visceral layer. The visceral layer means the layer of pleura which is closely investing the lungs, or which is closely related to the lungs, or the inner layer, that is known as a visceral pleura. And the one which lines outside this visceral pleura, we have the parietal pleura. Okay, the parietal pleura lines the inner aspects of the thoracic cage, like we have the ribs, costal cartilage, intercostal spaces. Okay, remember the innermost layer of the thoracic cavity is the endothoracic fascia. Endothoracic fascia. There is a fascia that is known as the endothoracic fascia. Remember, outside this parietal pleura, what layer you can see? There is endothoracic fascia. We have the endothoracic fascia. Outside the endothoracic fascia, we have the ribs, intercostal spaces. So these are the ribs. Okay, on either side, anterolaterally, ribs anterolaterally, and posteriorly, there is a vertebral column. The vertebral column posteriorly. Okay, so here is the intercostal space. So in between, there is a connective tissue that is known as the endothoracic fascia. For the purpose of description, the parietal pleura can be divided into costal pleura, diaphragmatic pleura, mediastinal pleura, and cervical pleura. What are these? Let us see. So here you are seeing a lung. This is the apex of the lung. Here comes the base of the lung. This is the mediastinal surface, and this is the costal surface. Okay, and the pleura which lines the apex of the lung, this is known as the cervical pleura. This is the cervical pleura. Okay, and remember, cervical pleura, it is lining the apex of the lung. Above the cervical pleura, there is a structure which is related, that is known as the suprapleural membrane. Remember, suprapleural membrane. Suprapleural membrane is related to the apical pleura. Okay, and the pleura which lines the diaphragmatic surface, this area is known as the diaphragmatic pleura. And the pleura which lines the mediastinal surface, this is the mediastinal surface. So here we have the mediastinal pleura, and the pleura which lines the costal surface is known as the costal pleura. Okay, so these are the different divisions of parietal pleura. So we have the cervical pleura, then comes the diaphragmatic pleura, then medially we have the mediastinal pleura, and on the lateral surface, laterally we have the costal pleura. Normally, the space between the parietal pleura and visceral pleura, there is a small potential space, and this potential space is filled with the pleural fluid. Okay, and this pleural fluid which helps in the expansion of lungs during respiration. Okay, but see here you can see this is the costal pleura and this is the mediastinal pleura. Okay, so here we are seeing the thoracic cage, and here we have the diaphragm. Okay, see the costal pleura. So this is the costal pleura, and here we have the diaphragmatic pleura. Okay, so when the costal pleura get reflected onto the diaphragmatic pleura, it makes a space over there. Okay, so that particular space is known as a costo-diaphragmatic recess. Recess means pocket. Okay, so what do you mean by costo-diaphragmatic recess? The reflection of the costal pleura onto the diaphragm gives a small space over there. That space is known as costo-diaphragmatic recess. The same way, when the mediastinal pleura get reflected onto diaphragm, it makes a small area there, that small pocket-like space, that is known as the costo-mediastinal recess. Okay, and you know, two recesses, pleural recesses are there. It has got some clinical importance. So here we have the costo-diaphragmatic recess, and medially we have the costo-mediastinal recess. Okay, you know, the costo-diaphragmatic recess is located inferiorly between the costal and diaphragmatic pleura, costal pleura and diaphragmatic pleura. Okay, remember, vertically it measures about 5 centimeter and lies opposite to 8 to 10th ribs. This costo-diaphragmatic recess, remember, it lies opposite to 8 to 10th ribs, opposite to 8 to 10th ribs in the mid-axillary line. So that is the extension of this costo-diaphragmatic recess, costo-diaphragmatic recess. In the mid-axillary line, the costo-diaphragmatic recess, okay, extends, or it lies opposite to 8, 9 and 10. So here you have the 8th rib, 9th rib and the 10th rib. Extends up to 8, opposite to 8, 9 and 10th ribs. Now, the costo-mediastinal recess we have here, it is located anteriorly between the costal and mediastinal pleura. Okay, lies between sternum and costal cartilage. Sternum and costal cartilage. You know, the left costo-mediastinal recess is larger due to the presence of cardiac notch. On the left side, you know, the left anterior border of the left lung has got a cardiac notch. You know that. Okay, because of that cardiac notch, the left costo-mediastinal recess is larger. Now, if you see this pleural cavity, the costo-diaphragmatic recess is the most dependent part of the pleural cavity. Okay, you know, during pleuritis, okay, I told you between the parietal and visceral layer there is a small amount of fluid. Okay, if the amount of fluid increases, this fluid get collected in this costo-diaphragmatic recess, and that condition is known as the pleural effusion. Pleural effusion normally get collection of fluid in the costo-diaphragmatic recess. You know, pleuritis or pleuritis is the inflammation of the pleura. Now I told you pleural effusion is the accumulation of fluid in the pleural cavity. So what happens if there is an accumulation of this fluid in this pleural cavity? What happens? Okay, so it limits the expansion of the lung during breathing, during respiration. Okay, so this particular space, that is the costo-diaphragmatic recess and the costo-mediastinal recess, gives a space for the expansion of lungs. Okay, so when the fluid get accumulated in this cavity, so it limits the expansion of the lung during respiration. And if during pleural effusion, that means the condition where the fluid get accumulated in the pleural recesses, so it has to be removed. Okay, that particular process is known as the thoracocentesis. 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 So what is thoracocentesis? It's a procedure by which excess fluid is aspirated from the pleural cavity. Okay, so here the fluid is get collected. This fluid has to be removed. That particular process is known as the thoracocentesis. That is the thoracocentesis. Now, what is thoracocentesis? You know, thoracocentesis is a procedure by which the excess fluid is aspirated from the pleural cavity. Okay, so remember these 2 points. Remember, so during this process, a needle is inserted into the pleural cavity. And remember, normally as for examination, the needle is inserted in the 6th intercostal space. 6th intercostal space, again along the lower part of the intercostal space. You know, intercostal space, it is the space between 2 ribs. So here, one rib here is another rib, and this area is known as the intercostal space. Okay, you know what are the contents of intercostal space? We have the intercostal muscles are there, then there is intercostal vessels and nerves are there. Intercostal vessels and nerves are there. Okay, suppose if this is the 6th intercostal space, remember this is the 6th intercostal space, the needle is inserted into the lower part of the intercostal space. Okay, so the needle is inserted around the lower part of the intercostal space, because upper part we have the intercostal vessels and nerves are there. Intercostal vessels and nerves present at the upper part easily. That is why the needle is inserted on the lower part of the intercostal space. Now let us see the nerve supply of pleura. Here we have the costal pleura, here we have the mediastinal pleura, and this is the diaphragmatic pleura. Okay, the costal pleura, okay, it is supplied by, so here it is related to the intercostal space. So here we have the intercostal nerves. Okay, so the costal pleura is supplied by intercostal nerves. Remember, intercostal nerves. Okay, whereas a mediastinal pleura, here we have a nerve that is known as a which nerve? Can you tell me the name of the nerve? This is the phrenic nerve. Phrenic nerve. Okay, the mediastinal pleura is supplied by the phrenic nerve. Okay, what about the diaphragmatic pleura? Okay, see, we can just divide the diaphragmatic pleura into two. Okay, the area, lateral part, there is a lateral part and the medial part. Okay, so this lateral part is supplied by the intercostal nerves, whereas a medial part is supplied by the phrenic nerve. Okay, see, now let us summarize like this. Costal pleura as well as the lateral aspect of the diaphragmatic pleura is supplied by the intercostal nerves. Okay, whereas the mediastinal pleura and the medial aspect of the diaphragmatic pleura, which is supplied by the phrenic nerve. Okay, then if there is an irritation of the costal pleura, okay, if there is an infection in the costal pleura, so where we get the referred pain? We get referred pain on the chest wall, because the chest wall as well as the costal pleura is supplied by intercostal nerves. So that is why if there is an irritation or any infection in the costal pleura, we get a pain over the chest wall. Whereas if there is an irritation of the medial aspect of the diaphragmatic pleura, medial part of the diaphragmatic pleura and the mediastinal pleura, so what happens? The phrenic nerve get irritated. Okay, the phrenic nerve, what is the root value of the phrenic nerve? Phrenic nerve root value is C3, C4 and C5. Okay, so what happens? One more nerve is there which is having the same root value, that is the supraclavicular nerve. The supraclavicular nerve. Okay, supraclavicular nerve is also having the root value C3, C4 and C5. So irritation of the mediastinal pleura and the medial part of the diaphragmatic pleura causes shoulder tip pain. The anatomical basis, because the mediastinal pleura as well as the medial part of the diaphragmatic pleura is supplied by the phrenic nerve. Okay, so the phrenic nerve is having a root value of C3, C4 and C5. The same the supraclavicular nerve does. So irritation of these part, that is the mediastinal pleura and the medial part of the diaphragmatic pleura, causes shoulder tip pain. So this is the anatomical basis of shoulder tip pain in the irritation of mediastinal pleura. Hope you understood the pleura, pleural reflection and the nerve supply of pleura. If you like the video, please share it with your friends. Thank you.